Hi, I'm Dr. Castañeda from Cosmet, and today we're answering some questions for gynecomastia specifically. Okay, gynecomastia means development of glandular mammary tissue on a male patient. Pretty much that's the definition. It can be due to various factors, hormone, overweight, and just genetics, no? But basically that's the term, gynecomastia. The usual type of patient that is looking for this type of procedure is somebody that has had some degree of development on the breast tissue. It's various degrees, no? There are people that have a little bit and they don't mind. There are people that have very small amount and it's a huge deal. And there's the opposite, no? I mean, there are extreme cases up to like double D cup sizes, no, on guys, no? So these extreme cases would require a different type of approach. But the idea is that, no, to come in, make an evaluation, and see what options we have. Well, mostly the problem is exactly that, the appearance. It gives these patients kind of a low self-esteem. They don't feel too comfortable with the upper body. There are different degrees, of course, but some people can be really affected, no, up to the point that it's really uncomfortable or embarrassing for these patients to go to the beach, go to a pool, take off the shirt. That causes a lot of anxiety in these cases. The typical is this case of a male patient that is having issues, especially during the teenage years when these hormone changes start to occur in the body, and that's the usual time of this to appear, no? Some people act on it right away, and today we did a 21-year-old patient. He was really fed up with this, and we've had 60-year-old patients that also are seeking flat chest. A gynecomastia reduction procedure typically is performed in the OR under a regional type of anesthesia and IV sedation. This means that the patient is asleep during the procedure, anesthetized from the chest on down, and breathing on their own. Unlike with general anesthesia, that you get connected to a machine and the machine is breathing for you. In this case, it's just like a deep sleep. After the patient is anesthetized, the usual approach for, let's say, maybe 80% of the cases, which can range from initial or very, very mild case up to like a medium-sized type of case. And a combination is usually done of approaches. First, liposuction is done in the whole chest area to give some shape and definition. And then small periareolar incision is done to extract the glandular tissue in just a segment, just like in the video right here. Then a drain is placed for about 2 or 3 days, and it gets removed after that. Incisions for the mild cases is usually a puncture-like on the chest, under the inframammary fold, and maybe like 2 centimeters around the areola. For more extreme cases, incisions need to be longer. A very extreme case probably is gonna be all across the chest, and the nipples coming out from the top part of that incision. Diagnosis is pretty much done by inspection, but if there is an ongoing hormonal imbalance, we need to know about it, so we can order some hormone testing with the pre-op labs, and we'll make sure that there is no other cause for this glandular development. Well, the ideal candidate could be, well, anybody with gynecomastia that wants to have a flatter chest. Now it varies, no, on this type of patients. Ideally, we need to have a nice skin tone, so usually just lipo and glandular extraction will do. In more extreme cases, that will not be possible because of the excess skin that could be left behind. So in those cases, we need to extract more tissue and making longer incisions on the chest. But I'd say this is about 10% of the patients that are really in this extreme category. Okay, usually non-invasive treatments are not successful in addressing the gynecomastia issue, mostly because of the dense glandular tissue that won't shrink, not with cool shaping, not with only liposuction, not with injections or like Kybella injections. The glandular tissue won't be reduced unless you cut it out. That's the only way. The fat, the patient can work out and lose some weight, but it's just going to be the fat part of the area. The glandular tissue won't come out. The liposuction is for sculpting and shaping the whole area of the chest. We want to give the pectoral muscle more definition, so it looks more athletic and it looks more anatomically correct for a guy. So that's the usual part for the liposuction. The glandular tissue is very dense, so it's a tissue that doesn't come out through a cannula like the fat does. So for this, definitely we need to go in through a small incision and extract this remaining tissue. The gynecomastia reduction could be done as an outpatient procedure. I leave this usually for my patients that live within a driving distance. They could go home the same day, and also providing they are like the first surgery of the day, if it's like the second or the next surgery in the day, probably it's more comfortable for the patient to stay overnight and then get released the next day. Well, you can expect a flat chest, of course. That is the main goal in this type of surgery. It's a flat chest with a little bit of definition in the pectoral muscle, if possible. And in the extreme cases, well, at least not having all this hanging, saggy breast tissue, that can really affect people's lifestyle. Initial recovery usually takes about maybe a week. For the drains that we were talking in the previous segments, these drains, it's just a little bit of like a silicone tubing that is attached to the skin. This can be removed in about 3 days after the surgery, and 1 week later, stitches from the periareolar incision are removed. Pretty much that's the recovery initially. Also, patients are wearing compression vest and some sponge to help minimize inflammation in the first period of the recovery. And it may take like maybe 3 weeks, 4 weeks to start an exercise routine, maybe an easy routine like stretching exercises, yoga, Pilates, something like that can be done at that time. Heavier workouts like bench press or something more physical like boxing, kickboxing, maybe 6 to 8 weeks, but that's the usual time. It's very important for patients to abstain from smoking at least 1 week before and 1 week after. This is super important because we can have complication of the nipple and the areola not receiving enough blood flow in smokers and have a bad outcome. So this is very important point. Results are fairly seen quickly. You're pretty much right after surgery already seeing a flatter chest, but well, it's gonna be bruised. Inflammation will set in. Final results do take about maybe 3 months to really see the final result, but within the first month you're pretty much feeling normal. All right, thank you. See you next time.